Cardiopulmonary resuscitation, or CPR, is a combination of chest compressions and rescue breaths. Good quality CPR gives patients with cardiac arrest the best chance of survival. The critical concepts you should learn from this course are: pushing the chest hard and fast, compressing at the rate of 100 compressions per minute, allowing full chest recoil after each compression, minimizing interruptions in chest compressions, keeping interruptions to 10 seconds or less, avoiding breathing too forcefully and deeply for the patient. CPR should be started immediately without delay to be most effective. To give effective compressions, kneel at the patient's side and make sure that he or she is lying on their back on a firm, flat surface. First, quickly move or remove clothes from the front of the chest, as these may get in the way of doing compressions. Put the heel of one hand on the center of the bare chest between the nipples. Then put the other hand on top of the first hand. Make sure the long axis on the heel of your hand is over the breastbone to reduce the chance of rib fracture. Your shoulders should be right over your hands, and your elbows should be straight. Now push straight down on the patient's chest, ensuring that you are pushing directly on the breastbone. For adults, you will press down 4 to 5 centimeters. After each compression, let the chest come back to its normal position, ensuring full chest recoil. This allows blood to flow into the chest and heart. It is good practice to lift the hand slightly off the chest to promote full chest recoil. Give 30 compressions at the rate of 100 per minute, counting out loud as you press. Remember what you are trying to do. Squeeze the heart and pump out the blood to the brain. When you stop pressing the chest, the brain stops getting oxygen, so keep pressing. When doing CPR, you should interrupt chest compressions as little as possible, no more than 10 seconds at a time. Now give 2 rescue breaths. This is done by placing your hands, as you did with the initial assessment, on the forehead and the jaw, and tilting the head back. Pinch the nose with fingers of the hand on the forehead. Open your mouth wide and cover the patient's mouth with yours. Breathe into the patient's mouth. Breathe gently until you see the chest rise. This should take about 1 second. If a breath does not result in a chest rise, reposition the head and try another breath. Without delay, start compressions again. Perform 5 cycles of 30 compressions and 2 rescue breaths. If the patient's condition is unchanged, continue CPR until the patient starts breathing or until you are relieved by somebody else who is capable of giving CPR. Your instructor will now take you through the steps of CPR in your groups.